I'm James Adams. I'm chair of the Department of Emergency Medicine at Northwestern University. Well, I've been doing emergency medicine 20 years in academic centers, trained in Pittsburgh, was in the military, in San Antonio, in the Air Force, combined Air Force Army program, and then up at Harvard at Brigham and Women's Hospital to help put emergency medicine into the Harvard teaching hospitals and help start the residency there. And then since 2000, I've been professor and chair of the department at Northwestern. Well, I was interested in everything. The classic answer for, I think, emergency physicians is that they like all the fields and all the disciplines. And I think people are cognitively structured to either tolerate the chaos of the emergency department or hate it. So I was drawn to that. I like the immediacy. I like the ability to address all of the important issues that patients came in with. And so it was a generalist mentality with a higher intensity. So there are very good books in emergency medicine, but one of the things that we do is focus on education and training. And so to bring a book that's focused on the learner of emergency medicine, not only the resident specializing, but the lifelong learner, the emergency physician, and to bring the chapters, the content, the tables, the texts, the algorithms that we know are needed, to bring it in one place was awfully appealing. So we want to make sure that our residents are trained and that they've achieved the competencies, knowledge competencies, procedural competencies. So this book has a competency mindset, that if the resident masters the material in each chapter, they should have met that knowledge competency for that domain. Clearly there's greater depth that could be mastered, clearly things could be summarized, but what we wanted to do was get authors of the chapters, editors of the book, who are educators, who understood education, understood competency-based education, and to deliver a product that would enable the trainees to meet the knowledge-based competencies. So the book is meant to be readable. We know that learners never have the time to read. It's always tough to find time to read. So we wanted something that was readable, that was appealing, that didn't compromise on content, but we would summarize that content in tables, in algorithms, in graphics that would enable the learner to go back and refresh very quickly. So a first-time pass might require concentration, the subsequent passes may be more quick, but enabling that in the right length, in the right format, at the right level of reading complexity was the trick. So we're moving from competency-based education, which was really launched around 2003, to milestones-based, so that a resident, when they've mastered a certain threshold of skills or knowledge, could progress into a next level. We're going to just try to figure out what that means, but having educational tools that support competency-based education, support milestones that help us theoretically or in fact know where the learner is at and how they're moving through their curriculum is awfully important. So we wanted a textbook to support that training.